Hi, good evening to everyone. I'm Dr. Philip McMillan, and today I'm doing a little bit of patient advocacy and highlighting the incredible work of whistleblowers. And that's by just reminding people about this very important issue that seems to keep on getting ignored. Similar to excess deaths, it's one of those very strange things that the embalmers noted where they were seeing very abnormal clots and they raised awareness of it. But largely, it has been ignored by the scientific and medical community. They don't believe it's happening, but they haven't investigated it. Well, what we'll be covering today is we'll be looking at a very similar pattern that occurred with asbestos. So I'll be going through this article that was recently published as I look for reasons to explain some of the patterns that we're seeing. Additionally, I'll be highlighting very quickly an important email that had been sent by Thomas Haviland to the CDC, FDA about the importance of this. And I'll be reminding you in the description below is the link to watching the original interview with the embalmers clots in the living. And this was done by a whistleblower who came forward and shared that actually these clots are not just happening in the people who have died and are being embalmed, but also in the living. Really critical video there. And actually, for those who are quite interested in it, as long as you're not squeamish, you have to realize that in effect that this video has been seen or liked over 250 times. I'll give you a quick glimpse as to what's in it. That's one of the examples in the pulmonary arteries, what they pulled out of a patient, so the patient survived. But this is critical information, and the whistleblower took a big chance to step forward. So I have a responsibility to keep awareness on this and try and help people to understand why, even when there are problems that are being observed, they seem to get ignored. Now, as usual, before I start talking about it all, quick important update, housekeeping issues. Again, please remember we are going for trying to get Humming Heroes #1, talking about nitric oxide and the impact that it can have in the nose. So we have just 7 days left, and this is the timing before it then goes launched on Amazon. You can see it's at a pre-order price. The aim here is to get to #1, so we've put the price as low as we can because we want support in order to do it. Additionally, coming up this Thursday in UK time is the third part of the Advanced COVID 360. This is the recording. It will be part of the course. And as usual, for those people who join me when we're doing it, they get to ask all the questions. That's the advantage of it. So please, if you are interested in being able to have the discussion as well as see the original presentation, please click on the link below. So let's get back to the point about the embalmer's clots. This is a big issue, and I know clinically it's relevant because if this is occurring with the embalmers and if it is occurring in the living, we are likely to see far more significant clots happening to patients. So that means bigger PEs, more likely to be, quite significant, could lead to death. You can have higher risk of heart issues if the clots there are forming. You will have higher risk of stroke disease. It has all kinds of implications if this is occurring. So you would think from a public health point of view, or even just a health point of view, even if you are not too sure about why it's occurring, why would you ignore it? Really important question. So, as I said, I'm going to be doing a parallel to what happened with asbestos to understand how the history works. Before I start that, I'm going to show you a short clip of the work that is being done by Thomas Haviland. Now, I interviewed him in April 2023. And he since subsequently he has been interviewed by John Campbell. He has been interviewed on this one by Cheryl Atkinson. He's been interviewed multiple times about the research that he has done global embalmer research, where up to, I think, 60 to 70% of embalmers who responded to the survey were seeing these abnormal clots. So, really important piece of information that needs to be clarified. So, I'm going to play a short clip from this recent presentation so that you can hear a little bit more about what it is that he was doing as he raised awareness.
Have you ever been able to learn whether there are any governments or any public information bodies that are collecting this data and interested in trying to figure out what it means?
I submitted my results to the FDA for their vaccine and related biological products advisory committee meeting, and I've heard nothing, Cheryl, from the FDA about it since then.
What kind of pushback are you getting or have you gotten? And how would you answer the criticisms?
Yes, some of the criticisms, people think that what I have done is unethical, that I shouldn't share the stuff that I see in this embalming room. And on one hand, I sometimes see their point, because what happens in here is kind of private and it's personal. However, at the same time, if I'm seeing something that may be affecting a whole lot of people and humanity might be at stake, by saying nothing is unethical. It's eating at my soul to leave it quiet, because many, many lives may be at stake. And no matter what's causing this, whether it's the virus, the vaccine, or whether it's, Cheerios or, a bad box of Cracker Jacks, something has to be found out what's causing it, because it's obviously a change in the blood.
The FDA did offer a response to full measure stating, quote, "The FDA and the Centers for Disease Control place a high priority on vaccine safety and are committed to our vaccine safety monitoring program. The FDA has not identified any safety signals for fibrous blood clots with COVID-19 vaccines." They also stated that since the observations were made on cadavers, quote, "it falls outside of the FDA's regulatory purview."
So, very interesting. So you can see that Tom has been doing an incredible job of pushing the regulators on this. Because as the embalmer just said, that's Richard Hirschman, why would you ignore it? It's occurring. What is the mechanism? That should really be the question. Is it therefore clinically relevant? That's the kind of question that you would think would be important for regulators. But clearly, the FDA are saying it's outside of their remit to be able to look at cadavers, even though what they are seeing could be relevant to what is happening in people. So here is what Tom sent to three people. He sent it to Mandy Cohen in the CDC, Robert Califf, FDA, and Monica Bergatoni in NIH. And he's been highlighting that in January 2024, he sent an email to all three, the Vaccine and Related Biological Products Advisory Committee, and to other members of your organizations, notifying you about the shocking results of my second worldwide embalmer blood clot survey in January 2023. So he highlighted the email, equally disturbing results to the Vaccine and Related Biological Products Advisory Committee. Neither all of the last year nor of the first 3 months of this year has a single person from any of the organizations contacted him about the results of the survey. They are not interested in the survey because, in their view, I guess it's on people who have passed away, so therefore it's outside of their remit. That's a problem because, as I said in the link below with the whistleblower, he clearly indicates this is occurring in the living. What's even more worrying is that other people are seeing it, but very few are willing to come forward because of the implications of saying anything like this. So this is pretty serious stuff. So how does this tie in with regards to history? So this is where I'm going, because sometimes you only understand stuff when you look at the historical context as to what has happened before. This was a really interesting article. And it was published in March, the 25th of March, 2024, Asbestos Cover-Up by Michelle Whitmer. And what they were looking at here is that the court documents provide irrefutable proof that the asbestos industry leveraged its power and influence to keep workers and the public in the dark about the hazards of asbestos. Dozens of companies were implicated in the decades-long cover-up. And you have to note that this is by the 1920s. They had identified the link between asbestos and asbestosis, a new and sometimes fatal lung condition. I mean, this is very similar to the fact that we are seeing a new pattern of disease that is occurring at this point, but it's being ignored, similar to what was happening at that time. And so this is the reality of what occurred. Favoring profits over health of workers, they established a connection between asbestos and lung cancer in the 1930s, and they were understanding mesothelioma, an aggressive cancer of the lining of the lungs caused almost exclusively by asbestos. And so, although they had this evidence, the influence of the companies were growing. And so between 1940 and 1980, it was a multi-billion-dollar industry employing more than 200,000 people. This is the reality. It was too much money, too much power that was involved in order for governments to actually impact on it. Because what would happen to all those workers who would lose their jobs? What would happen if they acknowledged the problem and that they had to then pay compensation to workers? It was all of that stuff that was going on in the background that caused it to be ignored. Look at this statement here. So this was from a Johns Mandeville employee recalling what the president, Louis Brown, said in a deposition. He said, "Mr. Brown, do you mean to tell me you would let them work until they drop dead?" He said, "Yes, we save a lot of money that way." This was purely about the financial implications. It wasn't about anything else. And is it any different today? You have to wonder. Let's look at the timeline here to get an understanding as to what happened with asbestos. So you can see here in 1858, this was founded, Johns Mandeville. This was one of the big companies around asbestos use. The first paper on the link to asbestos was in 1924. And as you can see, going down 1929, 1931, I clearly saw an association with mesothelioma affecting the lungs. This kept on going all the way down. They convinced the government to limit asbestos regulations and safety inspections. This is in the 30s, going down all the way 1940s. Then in 1949, the future medical director of Johns Mandeville advised the company against telling its sick workers they have asbestosis. This is going on now for almost 30 years. You'd think to yourself, really, what in the world could have happened that would cause that to occur? Really important point. Now, now look at this here. In 1962, Irvin Seekoff uncovered a definitive link between asbestos exposure and cancer in 1962. In 1964, the industrial leaders claimed they had no knowledge of the risk prior to 1964, but the confidential documents prove otherwise. You can see the evolution of what is likely to happen as things start to fall apart. Everybody will be saying, well, we didn't know, we didn't quite understand what was going on. It's unbelievable because everyone keeps on assuming this is going to go away. This is not going to go away because the scientific mechanisms around autoimmunity, around circulating spike protein, mean that this process is going to keep on happening. And the longer it takes for it to be addressed, the harder it will be to resolve. So you have to understand, and this is why I picked asbestosis, because when you think about asbestosis, the problem is by the time a diagnosis is made, there is no treatment. There is nothing that you can do. You can only treat the patient as best as possible. Look at what happened in terms of real world. So in 1960, this groundbreaking report of asbestos by the pathologist J.C. Wagner led to significant upgrades in safety standards in the UK. But 30 years after he published his initial findings, he reversed his positions. So what then happened is that it gave the industry further time to continue with the cover-up. And this extended all the way through. Asbestos in the UK was not banned until 1999. So you're talking about almost 100 years of knowing this was a problem, but it still continued because of the financial implications and the fact that no one wanted to acknowledge the cost of everything that would have happened. Even today, when patients die, if they have asbestos exposure, their families are still being paid out for the fact that there was asbestos exposure. That's the reality as to what is happening today. If this occurred in the context of other things, and this is the important point for us to reflect on, just think about that elephant. I always make reference to it because it's relevant. There is an elephant in the room. And the implications of this are not just about health. They're actually about finance. This is about litigation. This is about responsibility. So the history of how this works indicates that it keeps on getting pushed down the lines, just as it is with regards to these embalmer's clots, because if these embalmer's clots are correct, you then have to look for a reason why. If you look for a reason why and you find that the implications are tied to something that you don't want to acknowledge, then the costs and the implications of it start to rack up. Only advocacy is going to change this. These things never change just by the hope that people do the right thing. It's only through advocacy. And advocacy needs to involve everybody. This is not just about me. This is about everybody recognizing the importance and the significance of what could occur in the health of a population if things that happened over the past few years are also damaging to health. Because that really is the question that we need to answer. If it is, what is it that can be done? And even if we can't do anything, we can protect others from the same outcome. Have a great evening.